In a hip replacement, essentially what we are doing is replacing the ball or the head of the femur and the cup or the acetabulum. So first we take a small cut in the skin. With a minimally invasive technique, this cut is around 4 inches big. We then reach the hip joint and separate or dislocate the head from the cup. The head is then osteotomized and removed. The cup is now prepared to receive the artificial implant, and this is done by reaming the cup. Once the cup is prepared, the implant is fixed to the bone. This can either be done by a press fit if you are using an uncemented implant, or cement if you're using a cemented cup. Next, the femur is prepared. This is done by rasping in progressively larger sizes till we get a good fit, and again then the implant is inserted. If it is an uncemented implant, it's inserted to give a tight fit which so the bone grips the implant, or if it's a cemented implant, the cement is introduced into the femur and then the implant is introduced. So the cement is what holds the implant to the bone. With modern implants and modern techniques, the hip replacement can function almost as well as a natural hip. So besides normal recreational activities like walking, light jogging, tennis, golf, climbing, lifting, patients can now even sit on the floor, squat on the floor, and take part in higher level activities and more aggressive activities as well. So modern implants allow the patient to function almost as good as normal. There is an entity known as a forgotten hip which we see very often. Here the patient's hip functions so well that he almost forgets that he has had a hip replacement. Newer techniques in hip replacement have made it a hugely successful surgery with minimal complications. So today it is probably one of the most successful surgeries available to mankind. The hospitalization and the post-operative pain is also minimal. Patients recover very rapidly and they can expect a vast improvement in their quality of life and the outcome. So I would advise patients who are suffering from a hip replacement to seriously consider a hip replacement, because your chances of anything going wrong are today minimal.